Hi, it's Dr. Janowski for Sonata. Today I'm just going to show you some very classic and common filler techniques for several areas of the face: the nasolabial folds, the corners of the mouth, the lip, and the cheeks. And we'll use a combination of microcannula technique, and of course microcannulas are blunt tip needles that are used for deeper injections to avoid bruising, and also classic needle techniques. And I'll show you how I approach the patient with these particular issues. So the first thing I do is place just a little bit of local anesthetic. I like to use this vibrata vibrational device. I also give the patient a vibrational device because it soothes the patient, it reduces pain, and distracts the brain. So we're going to just put a little bit of this vibration in my left hand. In my right hand we're going to inject just a small amount of local lidocaine with some epinephrine right there. That'll be our entry point. And I'll do the same thing on the other side. Good. We take our pilot needle, we make a tiny little poke. The patient will be numb, so probably won't feel it. And some little injection there. And on this side, this is for the purpose of creating an entry point for our cannula. So we made one entry point on each side. Resistance there from a little bit of fascia, and then we just poke through it using the left hand to guide the cannula and provide a little counter traction like that, so we can see it filling up as we inject there. Good, that's well. And we'll do the same thing on this side using our little entry point, a little poke, a little pressure, a little bit of resistance. There we go. And then retrograde injection into the cheek area, watching the product fill the area. Okay, there we go. That's good. So that was the cheek. Is it on?
Yeah.
So now we're going to inject the nasolabial folds. I'm going to use a needle, so I like to use the vibration whenever I'm using a needle. It just makes it hurt less. I'm using a 30 gauge needle, and this is Restylane. We're going to put some on each fold with just some micro injections. Here we go. Of just some very small serial punctures like that. Sorry, that was a little bit ouchy with that stuff. We've already put some numbing cream on her, which we wiped off. And then I'll do the other side again with the vibrational device. Okay, now we're going to work on the corners of the mouth with some Restylane lift. Again, I like to use the vibration, and also I can lift with that on my left hand. And then small superficial punctures to help provide support to the corner of the mouth. Small amounts at a time, lifting that corner. Good, so that's one side. And then again we'll just do a little tilt, slightly open mouth, and we'll go into that commissure and we'll inject very superficially, serial punctures with a firm product like Restylane lift so that we provide support. So I've placed some filler into a very small 0.3 ml VD type insulin syringe, and these are great for superficial injections of the lip, and also anything on the skin surface like a fine line or a scar. So we're just going to help a little bit with these little scars and pores here. So again, I'm going to use my vibration tool, and we can really get very close to the skin surface without any concern of it showing or bumping up onto the surface. It won't happen. And we can really get into these small scar areas and fine lines and things like that. Let's take a look on this side here. It's a little bit of a scar right here, so again we can really get intradermal and flatten them out. Just massage it with your finger. There you go. Good. We're going to do the lips open slightly. And again, we use that same little BD insulin with the 5/16 needle on it, 31 gauge. And we can make very small punctures, and the patient's quite comfortable. The numbing works very well. With the cream, there's also a little bit of lidocaine in the product, so we can distribute this around the lip, look for asymmetries, help the natural bow shape of the lip, inject into the GK point, which is this point right here. That's a little more sensitive. And we're getting it in quick here. And open just a little bit there, and then I like to enter from below the lower lip, creating these natural tubercles, the two natural tubercles of the lower lip. Enhancing them, we want good lip proportions so the bottom lip remains bigger than the top. We don't want a top lip that's too big, doesn't look good. 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 We've got a nice bow shape. We're just going to enhance what we've got. She already has a nice shape. Help the lateral upper lip. We don't want to go too far on the lower lip. We want it to taper. Get it a little closer. It's looking real good. The lip will look a little bigger than our final result because it always settles a little bit. Okay, that's it. So we completed our filler treatment today. We did the cheeks using the microcannula technique, and you can see a nice enhancement of the lateral cheek. We softened the nasolabial folds, gave support to the oral commissures and marionette lines, and then enhanced the lip. And so we used a combination of needle technique and microcannula technique with minimal discomfort and most likely minimal to no bruising. The patient can typically go back out to doing their normal activities. How did you do?
Oh, fantastic. It really doesn't hurt.
Yeah, so we make sure it's a pleasant experience. So that's some classic filler injections here at Sonata.